Today discuss about important childhood disease measles, also called as rubeola. So this one also called as rubeola virus. Start with the family to which measles virus belong, Paramyxoviridae. These are enveloped helical single stranded RNA virus. So these one are enveloped helical single stranded RNA virus having an unsegmented RNA genome. Unsegmented RNA genome. So these are enveloped helical single stranded RNA having unsegmented RNA genome. The following important 6 genera belong to Paramyxovirus Paramyxovirus. The following 6 important genera belong to Paramyxovirus. First genus rubella virus, which containing para-influenza gene 24A4B. Then genus reciprovirus, para-influenza 1 and 3. Then genus pneumovirus, which containing RSV, that means a respiratory syncytial virus. Then genus morbillivirus containing measles. Then metapneumovirus containing the human metapneumovirus. Genus this Henipa virus. This one contain Hendra and Nipah virus. So these are the 6 important genera: rubella virus, respirovirus, pneumovirus, morbillivirus, metapneumovirus, and this Henipa virus. These are all the only one virus which is zoonotic, meaning they have an animal reservoir. Now genus morbillivirus, for which the measles virus morbillivirus which the measles virus belong is 120 to 250 nanometer roughly spherical virus, which is enveloped helical, having a helical nucleocapsid. Notice the other member of that the same genus are canine distemper virus and rinderpest virus. So this canine distemper virus causing disease in a dog, and rinderpest virus causing diseases in cattle. So measles is closely related to both these virus. So measles closely related to canis and rinderpest virus. Canine virus causing disease dog, this rinderpest virus causing diseases to cattle. Now the measles virus containing, because it is enveloped, okay, it is enveloped, it has H and N glycoprotein which is embedded in its envelope. Now this H also called as heme glycoprotein, responsible for binding to the receptor on the host cell. The measles virus containing H and N glycoprotein which are embedded on its envelope. Now this H also called as heme glycoprotein, responsible for binding to the receptor on the host cell. And H protein, unlike some paramyxoviruses, does not have neuraminidase activity. Now heme spike Why it is called as heme occludin? Because when it bind to mycoprotein receptor on RBC, it causes occludination of RBC. Now, what RBC does it occludinate? It occludinate monkey RBC only because it does not have the neuraminidase activity. This occludination is not reversible because generally when neuraminidase activity is present, it leads to destruction of the receptor of the host cell and hence leads to reversal of occludination, and so which means no reversal of occludination or illusion is seen in case of measles virus. In case of measles virus, there is only one zero type of measles virus, F glycoprotein, which is responsible for also called as that fusion glycoprotein, and it is responsible for entry of virus into the host cell because it bring amount of fusion of that viral envelope with the host cell. So F protein also called as fusion protein, it is responsible for fusion that viral envelope with the host cell membrane. The F glycoprotein is also responsible for syncytium formation. So it is also responsible for syncytium formation and also having hemolysin activity. Now that measles and acute highly the measles and acute highly infectious disease characterized by fever, respiratory syndrome, maculopapular rashes. But why it is so important? Because it has serious complication associated with it. Measles is endemic throughout that world. Epidemic occur every 2 to 3 years. Season when it is most when these epidemics occur are winter and early spring. Second attack rate more than 80%, and the most common age group affected 3 months to 3 years. Human are that sole reservoir. Most of that paramyxoviruses strictly human pathogen except only one, that animal reservoir, Hendra and Nipah virus. Hendra and Nipah virus, that one is the animal, remaining all this one human reservoir. More of infection of measles is respiratory secretion of a case over short distance or indirect contact with the infected secretions. Once the virus is able to infect that respiratory mucosa, it multiply in these mucosa cell, then spread through regional lymph node. Whether further replication occur, it is followed by first on that primary viremia, then it is infected the reticuloendothelial cell, replicate further. This is followed by a secondary viremia, and this is associated with the dissemination of that virus throughout that body. Incubation period 8 to 15 days. 10 days onset of fever, 14 days onset of rashes. Then period of infectivity, maximum chances of infectivity other individual is 4 days before and 5 days after onset of rash. Initially around 10th day, the patient has an prodrome which is associated with fever, sneezing and running nose, cough, redness of eyes, appearance of Hoplik spot. Let's talk about more about this Hoplik spot. These are small bluish white ulceration on a red base on the buccal mucosa, especially opposite the second and first lower molar. Remember, opposite first and second lower molar, these complex spot are seen. These complex spot may also appear on that um, soft palate, the conjunctiva and vaginal mucosa. Spot these complex containing giant cell, this one containing giant cell and viral antigen. They disappear before the rash of measles appear on the skin. The rashes appear around day 14th after infection of antibodies started to appear and that vermia disappear. The rash is a pink discrete maculopapular rash first appear behind that ears, then spread to that forehead, then spread on the rest of that space, and progressively it is spread to that chest, trunk, and lips. And a lot of areas are conflict rashes are seen on that body. So the rashes are pink discrete maculopapular rashes first appear behind that ear, then spread forehead, then rest of that face, then spread to chest, trunk, lips, and limb. Then confluent rashes are seen on the body. Rashes in the same order as it appeared and disappeared is starting around 3 to 4th day after onset. The last rash resolves with disquamations. Often these rashes may be absent in patients who have impaired cell-mediated immunity like AIDS or leukemia. Then diagnosis of measles is done by collecting respiratory secretion, nasopharyngeal, conjunctival swab, blood and urine. Smear of respiratory secretion and demonstrate giant cells. Then we can isolate viruses by cell culture. So we can use lot of cell line. We can then detect the viral antigen by immunofluorescent. Around the first and second day after inoculation, and characteristic of cytopathic effect which is seen in most paramyxovirus syncytial formation. So we can isolate viruses by cell culture. We can use a lot of cell line. We can then detect the viral antigen by immunofluorescence first and second day after inoculation. Characteristic cytopathic effect which is seen most paramyxovirus syncytium formation. Then we can also detect the growth of virus by putting on the cell line of monkey RBC, which will get heme absorbed on to the cell line. This would be seen only around the 10th day of inoculation. Remember, cell line culture can be detected by either immunofluorescence or by cytopathic effect or by heme absorption of monkey RBC. Most sensitive and specific would be detected to the viral RNA by real-time PCR, RT-PCR. Serology is Serology is most common method for diagnosis. We can detect measles virus specific IgM RBC in a single specimen of sufficient serum that will diagnose acute infection, or we can demonstrate fourfold or a greater increase in measles virus specific IgG antibody between paired sera. So acute serum we will collect around at the 7th day after rash onset, and convalescent serum we will collect around 10 to 14 day after we collected the acute serum. Complication, most important complications are secondary bacterial infection or respiratory tract due to either streptococcus pneumonia or Haemophilus influenza type B or staphylococcus. Amongst these secondary bacterial infection is most common complication is otitis media, seen in 10% people with measles. Incidence in 1 in 10. Complication, acute tracheobronchitis group may result airway obstruction. Pneumonia, most common life-threatening complication, 90% of measles related to death. Incidence 1 in 20. Next complication seen in immunodeficient malnourished children in pneumonia is called as giant or Hertz pneumonia. Giant or Hertz pneumonia. Then no specific antiviral therapy. Treatment purpose, no specific antiviral therapy. General supportive measure, hydration and administration of antipyretic agent. Then prompt antibiotic treatment. Clinical evidence of bacterial infection. We can find out secondary bacterial infection means we want to control that bacterial infection. Then according to WHO recommend vitamin A, this 2 lakhs international unit once daily dose of vitamin A, once daily dose. Prophylaxis, passive immunization, IM immunoglobulin within 3 to 6 days. So in this video we discussed the measles virus. It comes under Paramyxoviridae family, genus Morbillivirus. This is the diagram. It having HN glycoprotein, fusion protein, nucleoprotein, then polymerase enzyme. Most common age group affected people 6 months to 3 years. Through respiratory tract, it will causes primary and secondary viremia. Pink, that rashes first started began that years. After that, forehead, face, spread to chest, trunk and limb. Based on the site of infection, we collected sample. Real-time PCR. Then complication because of secondary bacterial infection. Then in immunodeficient and malnourished children have giant cell and Hodge pneumonia. No specific antiviral therapy. Proper antibiotic we want to take. According to World Health Organization recommend vitamin A dose daily, once daily dose 2 lakhs international unit. Then prophylaxis IM immunoglobulin 3 to 6 days. Thanks for watching.